hemophilia. This month, we are also acknowledging hemophilia across the country. And so today it's going to be a two-part segment in the interest of time. As my computer loads. Okay. So what is hemophilia? Hemophilia is a rare disorder in which the blood does not clot. The typical way because it doesn't have enough blood clotting factors. If you have hemophilia, you might, for some reason, after injury, bleed a lot. So this is what a normal blood vessel look like. If you have a tear, the platelets, clotting factors form, and this is your blood. With the hemophilia, they're missing all the platelets. So you just bleed out completely. So what are the signs and symptoms that the hemophiliacs have? So signs and symptoms of hemophilia vary depending on your level of clotting factors. If your clotting factor level is mildly reduced, you might bleed only after surgery or trauma. If your deficiency is severe, you can bleed easily for seemingly no reason. And these are some pictures I'm showing of some hemophilia that has bleeding in the joint spaces, what that looks like, and a finger, of course, that is cut with a lot of bleeding. So signs and symptoms of spontaneous bleeding include unexplained and excessive bleeding from cuts or injuries, or after surgery or dental work. Many large or deep bruises, unusual bleeding after vaccinations, pain, swelling, or tightness in your joints, blood in your urine or stool, nosebleeds without a known cause in infants, unexplained irritability. Other signs and symptoms, bleeding into the brain. A simple bump on the head can cause bleeding into the brain for some people who have severe hemophilia. This rarely happens, but it's one of the most serious complications that can occur. Signs and symptoms include painful, prolonged headache, repeating vomiting, sleepiness, or lethargy, double vision, sudden weakness or clumsiness, convulsions, or seizures. And these symptoms can also mimic other illnesses as well. Signs and symptoms in babies and children. Sometimes babies assigned male at birth with hemophilia are diagnosed because they bleed more than usual after being circumcised. Other times, children develop symptoms a few months after they're born. Common symptoms include bleeding. Babies and toddlers may bleed from their mouth after minor injuries like bumping their mouth on a toy. Swollen lumps on their heads. Babies and toddlers who bump their heads often develop goose eggs, large round lumps on their heads. Fussiness, irritability, or refusal to crawl or walk. These symptoms may happen if the babies and toddlers have internal bleeding into a muscle or joint. They may have areas on their bodies that look bruised and swollen, feel warm to your touch, or make your child hurt when you gently touch that area. Hemoptysis, hematomas. A hematoma is a mass of congealed blood that gathers under babies' or toddlers' skin. Babies and toddlers may develop hematomas after receiving an injection site. Types of hemophilia. There are 3 types. Hemophilia A, this is the most common type of hemophilia. It happens when you don't have enough clotting factor 8. The CDC estimates about 10 in 100,000 people have hemophilia A. Hemophilia B happens when you don't have enough clotting factor 9. The CDC estimates that 3 in 100,000 people in the US have hemophilia B. Hemophilia C is also known as factor 11 deficiency. This hemophilia type is very rare, affecting 1 in 100,000 people. The causes of hemophilia. Congenital hemophilia. This hemophilia is usually inherited, meaning a person is born with the disorder. Congenital hemophilia is classified by the type of clotting factor that is low. Acquired hemophilia. Some people develop hemophilia with no family history of the disorder. This is called acquired hemophilia. Acquired hemophilia is a variety of the condition that occurs when a person's immune system attacks clotting factors 8, or 9 in the blood. It can be associated with pregnancy, autoimmune conditions, cancer, multiple sclerosis, and drug reactions. Hemophilia inheritance. In the most common types of hemophilia, the faulty gene is located on the X chromosome. Everyone has 2 sex chromosomes, one from each parent. Females inherit an X chromosome from the mother and an X chromosome from the father. Males inherit an X chromosome from mother and a Y chromosome from the father. This means that hemophilia almost always occurs in boys and is passed from mother to son through one of the mother's genes. Most women in the defective gene are carriers who have no signs or symptoms of hemophilia, but some carriers can have bleeding symptoms if their clotting factors are moderately decreased. How do health providers diagnose hemophilia? A healthcare provider will start by doing a complete history and physical examination. If you have hemophilia symptoms, the provider will ask about your family's medical history. Providers may do the following tests: a complete blood count, or CBC. Providers use this test to measure and study blood cells. Prothrombin time, or PT test. Providers use this test to see how quickly your blood clots. An activated partial thromboplastin test time. This is another blood test to time blood clot formation. Then you have specific clotting factor tests. This blood test shows levels of specific clotting factors, such as factor 8 and factor 9. This will conclude my presentation for today. We'll pick the rest up on next Sunday. Thank you so much for your time and attention, and enjoy the rest of the service. God bless.